Everything is just fine and dandy in the paediatric unit at Alderskirk. They've just had CQC in and got an overall good rating for all of the services in paediatrics and paediatric A&E. Actually, that's pretty amazing. So do you know what? Life's actually pretty good. We think we're doing a good job and CQC have rated us as good, so that's just great news. We're a standalone paediatric unit, so slightly different to the tertiary centres around us or other bigger hospitals. What we are is a paediatric unit that's got outpatients, paediatric A&E, paediatric assessment unit, resus, our community nurses, and all of our acute paediatrics all within walking distance of each other on the same floor, all interconnected. And do you know what? That's actually something pretty special. We don't have specialty support on site, but actually we managed to deliver pretty good service within that. In fact, actually for a minute, if we step back, we think we're pretty awesome. Stop just a minute. Since when exactly was good enough? Come on, guys. UK paediatrics isn't quite the star performer we sometimes think it is. Our diabetes results don't compare well with the rest of Europe, and our asthma deaths are frankly shocking compared to the rest of Europe. So how, even if we think we're doing good in our CQC rating, how can we be as good as we want to be? So step away from the bubbles and get off of your bahookies and do something about it. Your mission, should you choose to accept it, is to dump good, ace excellent, and get to the top of the pops on paediatric safety. Are you willing and able to take on this challenge? Wrong answer. Try again. Okay, if we're going to do this, I think we need to phone a friend. Let's dial Paediatric Intelligence Team Safe. Please enter the password.
Somebody help, not just anybody help, you know I need someone help.
By Jove, they've got it. Okay, so it's all about the huddle, the druggle and the cuddle. We shamefully pilfered everybody else's resources but still managed to design our own unique huddles. Just like everywhere else, we didn't just have one or two people we thought might be resistant, we had the one in the corner that says no to everything. And our biggest shock was we thought we'd have to put all of our energy into trying to convince these few people, and in particular that one person. In actual fact, when we asked them, they all went for this as a really good idea. So all that energy we had ready, we didn't need to use it. But what actually happens in the huddle? First and foremost, it's everybody who's around for that shift getting together. It's about sharing all the patients who are scoring on the Pew scores, and it's about sharing all the patients who we have a gut feeling about, or the parents have a gut feeling about, or there's just some other risk factor like they're a self-harm patient, or they share a name with somebody else, or some other reason that we ought to be thinking about them especially. And what it's not is an opportunity for every nurse to tell you about every patient, and it's also not an opportunity for the management to try and ask us to do more and more tick boxes. We've managed to resist that by just going on about how this is only about situational awareness, about the here and the now and what's happening in the next few hours, or just reviewing the previous few hours. Because as a unit we're not seeing an awful lot of the big issues like the arrests or the ICU admissions, the number of days between them actually is not a good measure for us. And one of the things we really wanted to measure was how happy families were, and also how happy staff were once this had really got embedded. We've designed blank emoticons to let parents show us how they're feeling or how their child's feeling in the ward. And we're also doing a staff well-being validated survey to try and see if it genuinely has made a difference to staff as to whether they feel more supported and more generally happy with things as they become. We have the first set of results, and just as we're finishing, we're about to put out the second set of questionnaires. We really went from 0 to 100% in running the huddles very quickly, but actually we've had to play around a little with how they're run and when they're run. We now have them after the handover in the paediatric ward, and at 2:30 in A&E, and at 9:30 in the paediatric ward again. We do feel safer, the ward feels safer, and the management also think everything looks safer. Another great bonus of this programme was that I got to do a QI practical improvement science course and managed to score 96%. But actually that's led on to a whole lot of other QI projects.
Created using Powtoon.